So what we're currently doing is a venous ablation procedure for venous insufficiency disease. So venous insufficiency disease typically happens when the veins in the legs, the superficial veins in the legs, basically carry blood back to the legs instead of going to the heart. And these veins cause essentially venous hypertension within the legs. And this deep veins, these superficial veins, essentially, when you have a sense of venous hypertension within the legs, you start to get chronic venous stasis symptoms, such as really bad darkening of the skin, and then you could develop an ulcer, which is the worst part of the disease. A lot of patients obviously do compression therapy and wrapping for this disease, but until you treat the etiology of the disease, it typically doesn't get better. So what we have here is an ultrasound that we've used to get a sheet into one of the bad veins here, the posterior greater saphenous vein, and we now have this ablation catheter in here, which we follow with the ultrasound, and we essentially use that to ablate the vein. So the next sound you're going to hear is basically the vein burning, and we burn for about 20 seconds at each segment, and then we pull the catheter back, and once we get the catheter all the way out of the sheet, that vein is essentially burned, and we basically eliminate the venous insufficiency.